Hello, I'm Mike Shearer, Executive Editor of the Columbus Dispatch, and I'm here today with Samantha Hendrickson, our Business and Healthcare reporter, to talk about her Sunday cover story this week on Ohio's declining birth rate and what it might mean for the state of Ohio. You might recall this past week we've run a series of stories on projections that Ohio is going to continue to shrink by about 675,000 people by 2050, while the rest of the nation grows by 17%. And one factor, although we'll talk about how big a factor it is in this conversation, is Ohio's declining birth rate. And Samantha has done a in-depth story about that that's appearing in our Sunday paper this week and online on dispatch.com. So I guess for starters, Samantha, as you worked on this story, what were your biggest takeaways just from what you learned about this issue of why Ohio's birth rate is declining?
Yeah, thank you so much for having me. There's, I think, a lot of interesting takeaways. I got to talk to several people who really just dive into them personally as like why they're choosing not to have children, etc., with the backdrop of all of this data. The biggest takeaways I think I took is cost is definitely a big factor. Anxiety around things like climate change and social issues is definitely a factor in why people are choosing not to have kids. But the biggest thing is preference. People are just finding fulfillment in other relationships and other areas of their life, in different causes, and kids just aren't necessarily fitting into that. The idea of the nuclear family is not necessarily as appealing as it was maybe 20 years ago to childbearing age people.
Okay. And the numbers behind that, 2023 Pew Research Survey found that just over half of U.S. adults 18 to 34 who are without children say they're interested in having them. In 2023, the CDC said we have the lowest birth rate in the country's history, with approximately 1.62 births per woman on record, and that's well below the 2.1 replacement rate needed for population. So I guess how big of a factor is this in Ohio's population decline? I mean, the national numbers say we're going to grow still, even though the birth rate's falling nationally too. So is this a big factor in Ohio's population issue?
So it's a factor, for sure. We're seeing a steady decline. 2021 in Ohio specifically was the lowest on record for number of births. Preliminary data from 2022 and 2023 shows that number is just going to keep going down. So it is a steady decline. But when I was talking to some experts, there's no need to panic just yet, essentially, is what they said. Maybe in 100, 150 years, those generations are going to see some effects. But right now, in both Ohio and the United States, a lot of those concerns around things like the labor market and having enough people to work enough jobs, etc., which is the main concern around population decline, those aren't quite going to hit us yet because the United States has an influx of immigrants from all different walks of life, and it still has that ability to attract immigrants, which is offsetting a lot of concerns about anything like a shortage in labor, etc. So we're not feeling the effects of the idea of this baby bust or population decline yet. It's something to keep an eye on, but we're not raising the alarm bells.
Okay. So when you spoke to couples, you mentioned earlier a few of the issues they're concerned about cost. Can you explain that a little bit? What are the exact cost concerns that they have of children?
So kids are expensive.
Yeah, well, I can agree with that, yes.
Humans are expensive. Yeah. Living right now as a human at whatever financial level that you are is just more expensive than it was previously. Inflation has hit really, really hard at the U.S. And so that's something that's certainly front of mind. I think the Northwestern Mutual did an analysis saying that based on USDA data, and then adjusting for inflation, etc., it's going to cost for a kid from birth to the day that they turn 18 around $330,000 to raise them. Okay. So that's much higher than it was even just a few years ago. That in about 2015, it was thought that 2017 was $100,000 less, around $230-some thousand. So inflation has definitely taken a hit. Affecting things like just rent, childcare costs, especially in Ohio, have risen very dramatically. But there's also a lot of cultural influence on what it means to give a child a good life, and that often comes with a financial burden. And a good life can be loaded language, right? And everyone has their own idea of what that is. But social media certainly hasn't helped. When I was speaking to Dr. Michael Betts over at the Ohio State University, he studies fertility, birth rates, and that's his area of expertise. And he was talking about how they thought in the 1970s, when more women were entering the workforce and there was more money coming into two-parent households, okay, people are going to have more kids. It's not actually what happened, is that people just put more resources into the few kids that they have. And that's a trend that's continued since the 1970s. And that's only been exacerbated by things like social media. You know, you have to have this particular organic baby onesie, or you also, or your kid even has to suddenly become a sports superstar and get a scholarship. Hobbies become things to help kids achieve things much later in life. And those are expensive. Piano lessons, any kind of sport that you're playing, extracurriculars in general. But then you also have things like you want your kids to have fun too. And that costs money. So there's a lot of anxiety and a lot of concern.
Well, today's young people were children during this kind of acceleration of childhood events where you have year-round travel baseball teams and all these different things and opportunities, which are great, but they also can wear on children too, obviously. So did that come up at all in your conversation with adults about why they're not having kids, just how childhood has changed?
Yeah, absolutely, for sure. And I think the expert that I spoke to, Dr. Michael Betts, he had given this term of like the professionalization of childhood. Again, this idea of wanting to raise your child in a world in which they can be the best that they can be. And that starts very, very early. I'm 27, so I'm considered to be of childbearing age. Not that long ago that I was like playing softball and basketball in the summer and softball and whatever, but I never thought of those as like things for my life necessarily. But I think even in just that short amount of time, 15 years or so, that's changed very dramatically. And it begs the question of like, if there's so much pressure being put on parents, how much pressure is also being put on the kids?
Yeah. Okay. Anything else that you learned during these conversations at all, or that stuck with you?
So I think there's been a lot of national conversations around child-free people, and this more so than just say, you know, the typical dinner conversation that you dread at like a holiday. Okay, well, when's it your turn? There's certainly been a lot more national commentary on the idea of like, what does it mean to be child-free and the investment that people who are child-free have in society. Every single person that I spoke to doesn't hate children, doesn't think that kids are bad. It's just not where they want to invest their lives. They want to invest them in other relationships. They want to invest them in other things like civil activities, maybe advocacy work, etc. That takes up a lot of energy. They want to be the village. We say it takes a village. Yeah. They would much rather be the village. They want to take care of nieces and nephews. They want to care for aging parents. They don't feel like they can necessarily do that while also having a child. So it's not that there's a stereotype of like, oh, child-free people just, don't like kids or don't feel that invested in things. The people who I spoke to push back very heavily against that, is like they care very much about their relationships and the people in their lives. They're just not finding that fulfillment in the nuclear family.
It's very interesting. Do you think any of them will reconsider as they get into their 30s or will change their minds about this? Or
every single person I spoke to said that they don't really currently have a plan to change their minds. But I know I actually had a couple that I spoke to who adopted out of Franklin County Children's Services because, strangely, it was cheaper for them to actually adopt a child at the time than it was to biologically have a child. Yeah. But they actually changed their mind about having biological children. They thought they would also have it alongside adopting and fostering, but then just realized that they wanted to find fulfillment in adopting and fostering lots of kids who need homes. So priorities are certainly shifting, and it could very possibly shift. But all the people that I spoke to just say, no, we've always felt this way, and we're just going to continue to live our lives this way and invest in different things.
Okay, great. And that couple you're talking about, they're fostering and adopting. I remember reading your article this morning, and so they're doing both. So really, they do have children.
They do have children.
They're adopting them for permanent adoption.
Yeah, so they do have one child that they permanently adopted. They had since he was a baby out of the hospital. Mm-hmm. They fostered 8 children since 2018. That's something that they early on just had decided in their relationship that they wanted to do. So they do have a child. They're not necessarily contributing to that declining birth rate that people are making out about, but they're
helping the kids who need help too,
exactly.
Which we certainly have plenty of in our community, unfortunately.
Again, it's this stepping away from this idea of the nuclear household, the nuclear family, and just finding different ways to care for people and invest in relationships.
Okay, great. Well, Samantha, thank you for joining us today to talk about your stories that are in the Dispatch and on dispatch.com this week. Next week, we're going to be talking with Mark Williams again about the $2 billion expansion of the John Glenn International Airport here in Columbus. But for now, that's this week's edition, and thank you, Samantha.
Thank you so much for having me.
All right, we'll talk to you folks next week.